Hi, everybody. We have a little bit of a more interesting, little bit of a different topic today, so I'm excited to get into the video. Just before I do, if you don't mind taking a quick second to please share or like or subscribe or comment on this video, I'd really appreciate it. So thanks in advance if you don't mind doing that. So I'm going to read the question out here. So the question is, are there infections or toxins that are known to specifically cause hypoxia, which is low oxygen concentration, poor tissue perfusion, so poor blood flow to the tissues, and shortness of breath? Pretty self-explanatory. And then there's a follow-up note saying long COVID seems to be a suspect for many folks. Sorry, talking all day, folks, so forgive the mush mouth here. Seems to be a suspect for many folks like me, but that begs the question of, oh my goodness, there's a read more. What is long COVID? Question mark, dysautonomia / POTS, or a hidden reactivated bug. Thank you for taking the time to discuss these things. You're welcome. So thank you for the questions. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So great questions. Hypoxia, poor tissue perfusion, and shortness of breath, all major issues if they are afoot. So kind of two parts to this answer. One part is that there are certain microbes that are associated with red blood cell destruction or interference with red blood cell activity, and there are certain other bugs that are actually associated with lower levels of certain blood cell parameters that could potentially lead to those symptoms. So that's kind of the one part of it. And then the other part of it is that what do we actually see in clinical practice? Or what do I actually see in clinical practice? So Bartonella and Babesia are both known to live inside of red blood cells, and they can potentially lead to anemia if we're anemic. So i.e. our red blood cells are levels are too low, then that's going to mean less ability to carry oxygen to the cells of the body, and so that is by definition hypoxia, and that can certainly lead to shortness of breath. And then over and above that, it could lead to poor tissue perfusion, because ultimately the perfusion is all about getting nutrients to the tissue, but also oxygen as well. So Bartonella and Babesia could be culprits in that regard. And then Ehrlichia and Anaplasma are both commonly associated with having red blood cell deficiencies. So it's oftentimes that they'll present with, those patients will have anemia when they're tested. And so that can cause all those symptoms as well, because it's all about interference with red blood cells. So on the one hand, it's like, oh, like what an interesting, great answer to that question. And yet in clinical practice, if we start to look at that, when I have patients who test positive for Babesia, Bartonella, it's quite rare that I see positive tests for Ehrlichia and Anaplasma, but I see them on a regular basis for Bartonella and Babesia. It's quite rare that the patients actually have like anemia when we look at their complete blood counts. It's really rare. Or if we say test their, we use a pulse oximeter to test their oxygen saturation, say if they're coming in for IV therapy or whatnot, we test that on everybody before we do the treatment. It's really rare that we'll see that that's below the normal range. So I even though when we look at the pathophysiology of these microbes, like yes, they could potentially lead to hypoxia, poor tissue perfusion, and shortness of breath. We don't always see that. Now the one exception to what I just said is that with Babesia, one of the clinical clues that it might be Babesia is this, what they call air hunger, where folks just have a sense of they just can't get enough air into their lungs. And oftentimes that's distinct from shortness of breath, as much as it sounds like, oh, that sounds like the same thing. The air hunger is more like it just doesn't make sense, and there's not really a rhyme or reason to it. It's not like, oh, I'm going up a flight of stairs and I'm huffing and puffing. It's more like, just randomly I'll get hit with like, I just feel like I can't get enough oxygen into my lungs for some reason. Patients describe it as being a distinct thing. So that is something I've seen on a regular basis with Babesia. So the further thing that I'll add to this this topic of conversation is that there's some compelling evidence that any type of persisting infection, or if a patient has mold illness or heavy metal accumulation, or all the myriad things that sometimes accumulate in folks or are present in folks who have complex chronic illness, that can lead to hypercoagulability, so too much coagulation happening in the blood. Essentially, some of the body parts of these microbes, or the endotoxins that might be released, or the mycotoxins themselves, they can trigger certain molecules to be released in the bloodstream, and then that tells the body, like, oh, we need to start clotting more. And so we can wind up getting this increased amount of fibrin being deposited along the blood vessel lining or blood vessel walls, and ultimately we get this hypercoagulability, this sluggish blood, and that can certainly lead to hypoxia, poor tissue perfusion, and shortness of breath. So that could potentially lead to those issues, and that could be caused by a myriad different things. So unfortunately, while it's like a relatively simple question, not really a simple answer. It's like, well, what kind of makes sense based on pathophysiology? What do we see in clinical practice? And then there's this kind of just generalized hypercoagulability where it's like, oh, anything could cause these symptoms potentially. But that is the honest answer anyway. So not a straightforward one, but it's an honest one at least. So if I had a patient who was presenting with hypoxia, poor tissue perfusion, and shortness of breath, I would certainly be, thinking, okay, which of these various things might be afoot, and looking at testing for the presence of different microbes, asking about maybe testing to look for history of mold exposure, mold illness, chemical exposures, detox pathway issues, the whole 9 yards. So all the things that I regularly talk about in my videos. So anyway, that's the answer. I'll leave it there for now. If there's more specific follow-up questions to this answer, by all means, feel free to post on this video, and I'll do my best to answer. As far as the other parts of your question here, I'm going to just leave it there for now, actually, just because the video time is kind of getting on, but I'll answer the rest of it in another video coming up soon. So thank you for the question. I hope this was of interest to folks. If there are further questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.